Hello, beautiful listeners. This is Joanna Dos Santos from Mindful Counseling. I figured I would talk to you today about what is anxiety and depression and how to really effectively deal with it. So let me just get straight to the point, is that we all suffer with anxiety and depression. And when I mean suffer, I mean in a sense of that we all need to also have it in order to go through life. Anxiety is the part of us that feels somewhat uneasy when it comes to taking a test in school, going on a first date, right? We all have a tendency to experience some jittery feelings, butterflies, and sort of different thoughts. And we need some of that to allow us to push forward. We need to experience some of us so that way we can make decisions. Then we have depression. And we too have to go through some form of depression in life in order for us to move forward in the future. And what I mean by depression is loss. Not necessarily losing a loved one, although that's part of it too, but losing a pet or a breakup, loss of, loss of a home, moving away to a different place. So depression is the part of us that experiences some sort of a loss of someone, something, sense of self. And we too have to experience that in life earlier on in order for us to prepare us for the future, because there will be bigger losses, right? I mean, we have to be realistic or human. We're not going to live forever, right? And the part of loss is the part of losing a job, getting a new one, breakups, anything that's associated with a loss can be a sense of depression, because we have to experience those feelings of uncomfort and sadness and frustration. So that way we, once again, can make decisions to move forward. So anxiety and depression, the way I voice it out, the way I educate, the way I speak to my clients, is to let them know that to feel anxiety and depression is normal. That it is not something that we should be avoiding. It's not something that we should be running away, or it's not something that is crazy, because it does exist. It's even the part of me, and I'll disclose some of my things, is first time I started a podcast. I was a little anxious. I didn't know what it's going to be like. I'm just going to talk and go from there. I just recently had a radio interview. It was a very short interview, but I've noticed that right before I got on air, my heart was pounding. That's anxiety, right? Stress. It prepares you. It's adrenaline rush. So all of these things are so normal. And with time, the more of that we experience, the more attuned, aligned we become with it. And the same goes for depression. I tell all my clients that sadness is okay. It's normal, and it is okay to go through this. And it's good in a sense if we're able to actually pick up on it and talk about it, because I think that's also a part of it that's extremely, extremely important. So like I said, anxiety and depression is extremely normal, and I think we all have to go through it to prepare for the future. How do we deal? How do we deal with anxiety and depression? So take it back and move forward. Anxiety and stress pushes us forward. It's the ability in us to make decisions and to handle some of those difficult situations, right? However, if there's too many racing thoughts and you can't sleep and you can't eat, or you eat too much, and if you sense that it interferes in your daily life, daily responsibilities, and it feels, like I said, overwhelming, maybe debilitating, inability to make decisions, That type of anxiety can prevent us from doing a lot of things, such as, what else? Leaving our homes, interacting with others, not wanting to be involved in particular activities, so almost like isolating. That's when we should be able to just acknowledge that there's something going on and I should maybe do something about it. We don't want it to get to a point where you're really isolating yourself, where you're staying home doing absolutely nothing, because that is not healthy. Depression, same way. Depression, like I said earlier, it is normal. However, too much depression may make us feel unmotivated, unhappy, frustrated, angry. Just like anxiety, it can manifest itself in different forms. Separating yourself from social activities, no longer wanting to be engaged in certain activities that brought you pleasure, or being around with your friends, separating, not eating. Once again, eating too much. To deal with depression temporarily is so completely normal. Like I said, you'll have a breakup. We deal with it. We are sad, not happy, right? It lasts for a few weeks, maybe months. Following up of how long it lasts and what your symptoms are, how you're behaving. If you notice that it's just not turning so well, that's when help is needed, or at least the ability to speak to someone. I think realistically speaking, most of us, and that's why I'm doing this podcast on this, when we hear anxiety, when we hear depression, and when we experience some of these either racing thoughts and behaviors, we feel like we need to isolate, separate, because we might feel like we're being weird or acting weird or not ourselves. And we almost avoid the ability to speak to someone. This is the moment where you should be talking to someone, or at least someone that you feel like would respect it and give you what it is that you feel like you might be needing to hear. A lot of times when we express ourselves to someone, we may feel like they're not giving necessarily us the response that we would want to hear, once again, because we're not talking, right? And false perceptions is when we want someone to say something to us, but we never tell that to them. So be mindful that anxiety and depression is normal. However, be mindful how long it lasts, what you're noticing with your behavior, what you're noticing with your thoughts, your routine, and how it has changed. What I always like to recommend as well is check in with your own self, your own inner individual inside of you, and ask yourself questions. When did this start? When did I notice that I stopped sleeping? When did I notice that I was more frustrated? When did I notice that I did not want to interact with certain individuals? Because at least through that, you can kind of give yourself a timeline when things may have started. Now, I'm going to say this in a very delicate way. Sometimes what happens today does not necessarily mean that it has to do with what happened today, but it could also mean that the way you are behaving or acting or whatever it is that's manifesting may have something to do that has happened in the past. It's just something that may have triggered you to respond this way today. And this is why I say how important speaking to a professional is. Depression, anxiety, the part of us that doesn't want to do things, whether it's work or not work, body aches. I mean, for goodness sake, how most of us, when we are anxious and depressed, and we may not acknowledge that we're anxious and depressed, but it shows up through our body. All of a sudden we have migraines and headaches, or our joints hurt. Our bodies hurt. Now, I'm mindful as well as I say this, because of course, when we are not feeling well and our bodies are hurting, of course, I will tell you to make sure that you get that confirmed with your medical practitioner, just to clear everything out of the way. But the reason why I say this is because sometimes anxiety and depression can sure bring up your how it manifests itself in pains. So yes, so I hope I'm talking to you in a sense of relating that anxiety and depression is normal, and too much of it is not good. Too much of anxiety, too much of anything, to be realistic, right, is not healthy. If I'm gonna have a chocolate, that's fine. But if I eat a whole, I don't know, shopping bag of chocolate, you know what the effect will be. You're just not going to feel well. You're probably gonna feel sick. That's exactly how anxiety and depression is. It's okay to have some of it. It pushes us forward. It's allowing us to make decisions. But too much of it does not allow us to make decisions. We don't feel well. We isolate, we separate, or we become angry and frustrated for no apparent reason. Everything can agitate us and frustrate us, and we take our frustrations on someone else. Depression is not just sadness. It is anger as well. So I hope that you guys found this helpful. If you do like these podcasts, please be mindful or give me some feedback. It would be greatly appreciated as to what it is that you would like to hear. Hopefully, I think I find joy in speaking to you and also knowing what it is that you would like to hear. I think that is one of the important reasons why I'm doing a podcast, is just to be curious what it is that other individuals, our listeners, my listeners, want to hear. And also to let you know that I also have started a YouTube channel with one of my beautiful colleagues who is also a licensed professional counselor. And the YouTube channel is actually called JDS Counseling. I know I'm referring to myself in this podcast as Mindful Counseling, which I might revise it a little bit, but everything else is JDS Counseling, and that's how you guys can find me. I have my profile on Psychology Today. I have my YouTube channel on JDS Counseling, which are technically the initials of my first name, Joanna Dos Santos. And the YouTube channel is really brand new. I'm just in the beginning stages of trying to see what it is that I want to do with it and what audience am I reaching. And to be honest with you, the YouTube channel is really primarily based, the same thing as this podcast, is the daily routines. What is it that we can do? And feelings that come up based on what is currently going on. Whether it is a pandemic or not, it's the daily issues that we are faced with. So if you'd like, check it out. You can always find me, of course, on Facebook, on Instagram, and through that, it is JDS Counseling as well. So everything really, if you guys ever are interested in looking me up, it's JDS Counseling primarily. So I hope you guys enjoy this, and I look forward to hearing from you and doing more of this to reach to as many of you as possible, because it sure brings me joy and comfort in doing this. So I hope you're well, and stay tuned and be healthy.